Hello everyone. I'd like to welcome you to my presentation on Attention Deficit Hyperactivity Disorder, or ADHD, a description of the disorder. We will be reviewing the definition of ADHD and reviewing the symptoms of the disorder. I will also examine comorbidity rates and common comorbid disorders, followed by the prevalence of ADHD, then the course of the disorder as people age. ADHD is a neurobehavioral disorder that interferes with a person's ability to stay on a task and to exercise age-appropriate inhibition. Those inhibitions can be just cognitive or both cognitive and behavioral. Attention deficit hyperactivity disorder is marked by an ongoing pattern of inattention and/or hyperactivity, impulsivity that interferes with functioning and development. People with ADHD experience an ongoing pattern of the following types of symptoms. Inattention refers to one's difficulty staying on task, sustaining focus, and staying organized, and these problems are not due to defiance or lack of comprehension. Inattentive symptoms present as overlook or missing details and making seemingly careless mistakes in schoolwork, at work, or during other activities. Having difficulty sustaining attention during play or tasks such as conversations, lectures, or lengthy reading. Inability to listen when spoken to directly. Hard to follow through on instructions or finish schoolwork, chores, or duties in the workplace, or may start tasks but lose focus and get easily sidetracked. Difficulty organizing tasks and activities, doing tasks in sequence, keeping materials and belongings in order, managing time, and meeting deadlines. Avoiding tasks that require sustained mental effort, such as homework for teens or older adults, preparing reports, completing forms, or reviewing lengthy papers. Losing things necessary for tasks or activities, such as school supplies, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and cell phones, to name a few. Easily distracted by unrelated thoughts or stimuli. Forgetful in daily activities such as chores, errands, returning calls, and keeping appointments. Hyperactivity refers to one's tendency to move about constantly, including in situations when it's not appropriate, or excessively fidgeting, tapping, or talks excessively. In adults, hyperactivity may present as extreme restlessness or talking too much. Impulsivity refers to one's tendency to act without thinking or have difficulty with self-control. Impulsivity can also include a desire for immediate rewards or the inability to delay gratification. An impulsive person may interrupt others or make important decisions without considering long-term consequences. Hyperactive and impulsive symptoms present as fidgeting and squirming excessively while seated, leaving seats in situations where staying seated is expected, such as in a classroom or in the office. To run, dash around, or climb at inappropriate times. In teens and adults, it's commonly presented as frequent restlessness. Unable to play or engage in hobbies quietly. A need to be constantly in motion or on the go, or act as if driven by a motor. Talking excessively, such as answering questions before they are fully asked, finishing other people's sentences, or speaking out of turn. Difficulty waiting in line for everyday activities. Frequent interruptions or intrusions on others, for example, in conversations, games, or activities. Comorbid psychiatric disorders often complicate the recognition, diagnosis, and treatment of ADHD. A 2017 multi-center observational study by Real and others utilized medical record analysis of 1,119 participants 17 years of age and younger from 18 ADHD specialty facilities located across Europe. As you can see in the slide on the upper left, their findings indicate learning, sleep, oppositional defiance, and anxiety disorders are the four most common ADHD comorbid disorders in the study. The slide on the lower right illustrates results from a 2006 study by Kessler and others that surveyed 3,199 participants aged 18 to 44 in the United States aimed at identifying ADHD comorbid prevalence into adulthood. Admittedly, the study is quite dated. Unfortunately, adult ADHD comorbidity research appears to be limited. However, this data does provide a glimpse into the most common comorbidities in adults. Note the elevated rates of bipolar, major depression, and substance use disorders. A recent study by Jogi and others, conducted in Dubai of 428 Middle Eastern pediatric patients with current ADHD diagnosis, examined the frequency of ADHD comorbidity in children and adolescents. The study used systematic sampling of medical records on a population of children and adolescents diagnosed with ADHD at a Dubai Children's Specialty Hospital between the years 2017 and 2020. As you can see in the pie chart, results indicate ADHD comorbidity is far more common than ADHD as a singular diagnosis. In fact, 77% of the patients with ADHD had at least one comorbidity, 42% had at least two, and 20% had at least three comorbid conditions. The top three comorbid disorders in this study are autism spectrum disorder of 24.5%, learning disorder 21.3%, and sleep problems 20.1%. A 2017 Canadian study by Katzman and others sought to explore the clinical implications of a dimensional approach to ADHD and comorbid disorders. They conducted a systematic review of 150 PubMed articles published between 1996 and 2016. The research indicates that ADHD is a common psychiatric disorder that goes unrecognized, undiagnosed, and untreated, and the most common psychiatric comorbidities that occur with ADHD in adults in the study are depression, anxiety disorders, bipolar disorder, substance use disorders, and personality disorders. The authors argue that with significant overlap between these disorders, ADHD should be conceptualized as a spectrum rather than a categorical disorder, such that it can significantly improve functional outcomes across all psychiatric comorbidities if treated effectively. A 2016 study by Danielson and others attempts to estimate the national prevalence of parent-reported ADHD diagnosis and treatment among U.S. children 2 to 17 years of age using the 2016 National Survey of Children's Health. Results indicate that in that year an estimated 6.1 million children, or 9.4%, had ever received an ADHD diagnosis by a doctor or other healthcare provider based on parent reports. Of these, 5.4 million currently had ADHD, which was 89.4% of children who had ever been diagnosed with ADHD and 8.4% of all U.S. children ages 2 to 17. The chart on the top right breaks down the data further into age group, male and female genders, current diagnosis, and lifetime diagnosis. As you can see, there's a sizable difference in prevalence with regards to both age and gender. A 2019 study by Ragunst seeks to identify the course and prevalence of ADHD symptoms from infancy to adolescence. This longitudinal cohort followed 1,374 children born in 1997 and 1998. It relies on symptoms ratings from mothers for participants ages 1.5 to 8 years old, teachers from ages 6 to 13, and self-report for ages 10 to 17. For control purposes, all participants were divided into 6 risk-related factor groups, with Group 1 having the fewest risks and Group 6 having the most. Risks include low maternal education, prenatal alcohol exposure, non-intact family, maternal depression, low child IQ, prenatal street drug exposure, early motherhood, and maternal depression. The top left chart denotes the inattentive scale, and the hyperactivity impulsivity scale is on the bottom. Hyperactivity impulsivity scale is on the bottom. The results appear to indicate a broad decline in hyperactivity and impulsivity symptoms was observed over a period of 1.5 to 17 years, while an increase in symptoms of inattention was observed. A 2021 article from Song and others attempts to assess the global prevalence and prognosis of adult ADHD in the general population through a systematic review and meta-analysis. The study utilized PRISMA guidelines in assessing peer-reviewed published data from global academic journals. The chart on the right identifies the prevalence and number of people with ADHD across various periods of adulthood in 2020. ADHD is broken into two categories: persistent adult ADHD with childhood onset, and symptomatic adult ADHD, regardless of childhood onset. Results indicate that the prevalence of both persistent and symptomatic ADHD decreased as age increased. In 2020, the prevalence of persistent adult ADHD was 2.5%, and that of symptomatic adult ADHD was 6.7%, equivalent to 139.84 million and 366.33 million people respectively affected across the globe. Well, that's my presentation on ADHD, a description of the disorder. Feel free to contact me with any questions or comments. Goodbye.